Thank you, David. Good afternoon and welcome to the U.S. Access Board session on our initial findings on artificial intelligence. My name is Katie Kale. My pronouns are she, her, and as a visual description, I am a white woman with long, light brownish hair. I am wearing a tan sweater and my dark rimmed glasses. I'm sitting in my office in front of the American and GSA flags. I'm a federal board member of the U.S. Access Board and the Deputy Administrator of the U.S. General Services Administration. And I am proud to serve as chair of the Access Board and to lead this session today. The Access Board's mission is to create access for all. The Access Board is an independent federal agency dedicated to accessible design for people with disabilities. The board is comprised of 25 individuals, 13 of whom are appointed by the president, and the other 12 are representatives from various federal departments. I would like to take the time to acknowledge my federal board members that have joined us at today's session and to thank them for being here. I would also like to take a moment on behalf of the board to additionally thank all of today's presenters and those in attendance for being with us today as we discuss artificial intelligence in relation to the disability community. A few housekeeping notes as we begin. First, this hearing is being recorded and live streamed to our YouTube page. American Sign Language interpretation and real-time captions are being provided. Presentation materials are available on our website and will be entered into the chat. All attendees will remain muted and with your cameras off. You may use the chat feature to the person labeled Chat Monitor if you need assistance. On the screen, you will find the agenda for today's session. To go over the agenda, after my welcoming remarks, we will begin the session with Amy Nieves, Public Affairs Specialist for the U.S. Access Board, who will provide background and initial findings from our AI series. After Amy, we will hear from our partners at the American Association on People with Disabilities and the Center for Democracy and Technology. We will close today's session with remarks from the U.S. Access Board's Executive Director and closing remarks. But let us first begin by welcoming Amy Nieves. Amy, over to you.
Thank you so much, Madam Chair. It's great to be with you all today on behalf of the Access Board. As we begin, I just want to acknowledge all of the hard work and dedication that went into these findings and into our AI series and work together with our partners from AAPD and CDT, as well as our leadership here at the Access Board and our Executive Director and our OTIS Director, Allison Levy, who could not be with us today. So I just wanted to acknowledge all of the work and collaboration that has gone into this, including the insights, comments, and testimonials from the community, AI practitioners, and our other federal partners. And so as we begin today's presentation, I wanted to just go over a little bit about the Access Board in case this may be one of your first interactions with us. We are a small independent federal agency who was established to establish the accessibility design guidelines and standards for the United States. And this includes the Architectural Barriers Act, the Americans with Disability Act, Section 508 of the Rehabilitation Act, and other accessibility federal laws. We provide free technical assistance and training and webinars, and I encourage you to check out our website for more information on the available services and resources that we provide. And we also have enforcement authority over the ABA, which entails access to federal buildings and federal agencies. So one of the works of the board was outlined in the executive order on safe, secure, and trustworthy development and use of artificial intelligence, which aims to maximize benefits while also minimizing the harms of emerging AI technologies. And this was issued by the Biden administration. And so that's what has spurred our work and our collaborative efforts together. So within that executive order, the Access Board was charged with several key tasks. The first was to solicit public participation and conduct community engagements. The second is that we are charged to issue some technical assistance and recommendations on the risks and benefits of AI, including the use of biometrics as a data endpoint. And this session will outline many of those recommendations and some technical assistance. Providing people with disabilities access to information and communication technologies and transportation services. And so these are the three key elements of the executive order that our agency was tasked to fulfill. And in discussions and approaches of how we would meet these tasks, one of the things that came from this was the first ever memorandum of understanding that the board undertook, knowing that we would need to leverage community expertise, people who are working on this space, to come alongside our agency to support our efforts. And so we have partnered with the Center for Democracy and Technology, or CDT, and the American Association for People with Disabilities, AAPD. And they are here with us today. On the screen, you'll see a group photo of all of us together gathered when the MOU was signed by our three executive directors on a historic day for the Access Board and the disability community. And so as we came together to make sure that we were doing our parts to fulfill the executive order to ensure safe uses of AI for people with disabilities, we decided that some of our key activities would be centered on community engagements and issuing recommendations. And so a few key things that have happened since that MOU signing back in May of 2024 is the launch of the board's first AI dedicated webpage. So on the Access Board's webpage, you can go to our access-board.gov with a /AI. And that's where you will find links to the executive order, background information, resources, recordings from all of our past engagements. After today's session, you will also find today's recording, but right now you can actually find the slides for today's session on that webpage as well. We're going to talk about a couple of the other parts that are on there in a moment. But the main key way that we have decided to approach this work in collaboration with our partners was to launch what we've called the Developing AI Equity, Access, and Inclusion for All series. And this was launched back in the summer after the signing of the MOU. And there have been 5 targeted sessions, and today is number 5. But let's go back to kind of review what those were. So the first session that we held back in July was an informational session where we wanted to make sure that people had terminology, information, and some foundational resources to explore and understand how people with disabilities are utilizing AI and what are some known risks and barriers that are currently presented. After that, we held a series of public hearings. 2 of them took place on August 8th, an AM and PM session for the disability community. And then at the end of August, on the 22nd, we held a hearing for federal agencies and AI practitioners. And all 3 of those were well attended and very engaging and informative. In addition to the hearings and the informational session, we put out a public request for public comments that went through the summer and concluded on October 31st of this fall. And then today, of course, we are presenting a summary of the findings from those activities. So I also thought it would be important for us to talk a little bit about what the reach of this series has been to date. We were able to gather some of the numbers of people that were reached through our series efforts. So at our informational session, 344 people attended live, and 706 people have viewed that session to date on our YouTube page and webpage. At our disability hearings, we had a total of 452 hearings and over 546 views. For the federal and practitioner hearing, 302 people attended live for that hearing, and 300 people have viewed it since that time. Through the public comment period on regulations.gov, we received 33 public comments from the public. And as of last week, 3,000 and over 800 people have visited our AI webpage. When you add that all up together, that's 6,450 plus intersections and touch points that people have had with this series to date. So how I'm going to go through the rest of my presentation is it's going to be in two parts. So the first of our initial findings is going to discuss the ways in which we heard and understood better through this series the benefits and uses of AI from the perspective of people with disabilities. And then I will be going through what we also learned about the risk for the uses of AI and provide some recommendations that have come from a collaborative effort through our partnership in our MOU. That part of the presentation will be sectioned into 7 categories. The first will be employment, followed by education, benefits determination, ICT, information communication technology, access to healthcare, transportation, and we'll also touch on the criminal legal system. After I've concluded my part of the presentation, we will also hear from our partners. So to begin, I want to also provide a little background information on AI. So artificial intelligence refers to how machines and computer programs can have the ability to think, learn, and make decisions based on information like humans. There are a few key terms that I'd like you to keep in mind and that may be helpful to you. The first is machine learning. Machines use training data to make better predictions. This is how the machine learns. Predictive AI refers to how the AI is analyzing training data to predict future outcomes. Generative AI is where the artificial intelligence is creating new content based on that training data. And biometrics refers to facial recognition, thumbprints, and retinal scans. So any biometric piece of how that is informing the data. There are many challenges with data that we learned about through this process in the series. One of which was that artificial intelligence using these data sets of training data to create output is based upon the inputs that are provided to it. Oftentimes, data may exclude accurate information about the disability community, and this can be due to differences in defining how disability is, existing stigmas, exclusionary data gathering practices. This can also contribute to discriminatory effects of AI on people with disabilities. In one of the hearings, we also heard from folks who had themselves tested out generative AI, asking them to draw a person with a particular disability and how that picture then in that image was skewed and inaccurate. And so we also heard about the importance of ensuring that that training data accurately reflects the disability experience. Throughout this process, we heard many folks who shared the transformational ways AI has opened up beneficial opportunities for them. And this includes assistance with everyday tasks, navigating indoor and outdoor environments, traffic safety, being able to read and analyze materials, This was, we heard of benefits around assisting them with communication, augmented speech, assistive technology. We heard how it was opening up opportunity for students with disabilities to utilize these products, to have a more equal opportunity and reduce stress and anxiety about the process and note taking and so forth. We also heard about many benefits in the employment space, as far as healthcare and independent living. Some of the uses that we heard particular examples of were on how AI has created improvements to assistive technology, such as increased speech recognition, automated captions, and other automated processes to technology. We heard about medication reminders and shopping lists, providing more independence for people with disabilities. Smart mobility devices were assuring safe navigation in indoor and outdoor spaces for people, and to be able to navigate more independently without assistance from another person. Adaptive smart home and solutions were allowing people to stay in their own homes and live more independent lives. Throughout this process, we also learned a lot about how AI-generated captions used in online meetings and on smartphones can improve communication and access for people with disabilities. We also heard that generative AI is supporting students with disabilities and navigating barriers while also increasing learning outcomes. We heard some of the benefits around how AI can help fill some of the gaps in traditional assistive technology. And again, it kept coming back when we were speaking with folks about how it has been beneficial, that this is allowing them to live more independent lives through that smart home and task management types of uses. So these were the ways in which we heard many of the beneficial uses of AI. We also heard how some of our federal partners are beginning to explore it and understand the use of AI for businesses and federal agencies. And there were three key areas that we learned. Is the first, that AI has the potential to increase efficiency, saving time that would be needed for manual reviews. We also heard how this is supportive of analyzing and monitoring tasks, using data analysis tools to identify patterns and spot irregularities. And lastly, we also heard how AI can help generate content, producing text, images, or other content based on learned patterns to help support the overall arcing goals of agencies. Some of the one example I'd like to share with you is during the federal and practitioner hearing, we heard from GSA on how they are particularly exploring AI tools to support efforts on converting high volumes of PDF documents to more accessible, high quality HTML formats for the GSA website. We also learned that GSA is currently investigating the potential uses of AI-enhanced captioning, transcription services, and document summaries. And recently hosted a hackathon where they asked developers to demonstrate some promising potentials to use AI to convert governmental jargon language on federal websites to more plain language to make them more accessible. So that's just one of the many examples that we heard throughout the hearings of how federal agencies are beginning to explore their use of AI. And that's all to say that we also learned and heard predominantly around the AI risks for disabled Americans. And again, I'm going to go through these under 7 smaller categories. And so what I will do is I will go through each category, provide some foundational information of what we learned, and then walk through some of the recommendations of where we are at this point. I want to reiterate that AI webpage and we'll ask the chat monitor to put that in the chat again for you all. You're going to be able to get a copy of these slides, but you'll also have the slides and the recordings of all of the hearings, as well as a link to the docket where you can review all of the public comments that we received, so that you also have an equal opportunity to review the same information that we received. And so I'm going to go through each of these categories, beginning with employment and ending with the legal system. So first, in employment, how is AI impacting people with disabilities in the employment space? We heard two key areas of where there is this intersection. The first is in the hiring tools that are being produced, as well as on-the-job tools that are being utilized by employers and supervisors in the workplace. And so hiring tools refer to automated employment decision tools, or AEDTs. And we also learned that they can sometimes unfairly screen people from jobs based on their disability. We heard from academics, we heard from others within the community that talked about that there were some discriminatory practices and biases in the use of these tools. We also heard a lot about surveillance tools and how they may not be calibrated for people with disabilities. So, to go further, some of the concerns that were raised during our series was the use of bossware technologies. And bossware technologies are technologies that allow continuous surveillance and automation of supervising tasks. So this is where no longer is a human supervisor. They're relying on a surveillance and an automated tool to do the supervising of a task performance. There are also wearable technologies, devices that are worn by an employee, such as a device that might measure driving fatigue detectors for someone who is operating an automobile or truck. Posture and limb trackers that can be utilized in there, as well as employee wellness monitors, such as those rings that can be worn, and other technologies where the person is actually wearing the device that is monitoring themselves and their bodily outputs. AI uses in hiring can also refer to accommodation requests, reviewing them, uh, parts of the interview, and resume reviews that are being processed in whole or in part with AI technologies in the hiring process. So those were the three main areas that we heard concerns about in the employment space during our hearings. So we have a few recommendations. I'm going to begin with a couple of recommendations for people with disabilities related to employment. People with disabilities should familiarize themselves with their employment rights, including their rights to individualized accommodations, processes, and an accessible hiring process. And then we also want to recommend that disability rights and justice organizations may be able to assist by continuing to raise awareness of employment rights and the impact that AI and algorithmic tools can have on job seekers and employees with disabilities. So we highly recommend that you familiarize yourself with your rights and continue to engage with those organizations that are raising awareness and having these discussions around AI and algorithmic tool use and equitable access for people with disabilities in the employment space. As far as employers, the recommendation is that employers should be evaluating automated tools used in the hiring process and how on the job, both pre and post employment, those are deployment that they're utilizing them, and also identifying any potential discriminatory impact on applicants' employees with disabilities. Our bodies are all different, so those wearable technologies may not work for everyone. So being aware of how those tools are being utilized, both before and after they've been deployed, will be very important for employers to also remember the disability rights laws related to employment in this process. In the space of education, I want to talk a little bit about how AI is impacting people with disabilities. We heard a lot about the integration of AI in schools, that it can be both helpful for advancing accessibility, like I mentioned earlier, in tailoring educational services. But at the same time, how AI is used in education may also lead to discrimination of students with disabilities and violations of their civil rights. So this could be their rights under the ADA, Section 504 of the Rehab Act, or it could be under IDEA, the Individuals with Disabilities Education Act, or potentially other state or local laws related to education. So some of the recommendations for people with disabilities are that students with disabilities and parents of disabled youth should be aware of the presence of the various AI-generated education tools. So making sure that you understand where and when those tools are being utilized. The disability community, including parents of disabled youth, should consider engaging with school administrators about the use of the tools and their impact on students with disabilities and having those discussions and dialogues. For public entities and for educators and school systems, some of the recommendations include that school system administrators should be assessing whether AI-driven tools may be disproportionately affecting students with disabilities. And there should be a way to conduct pre-deployment audits of AI-enhanced technology prior to the adoption and also ensuring ongoing monitoring so that discriminatory impacts can be more readily identified. For the private space of education, this is for those that are developing these particularly education-based AI-driven tools. Developers of education technologies should be considering the accessibility of the tools to ensure that people with disabilities also have the opportunity to utilize the beneficial tools and follow principles of inclusive design when creating their tools. Developers are also encouraged to carefully evaluate whether their algorithms may lead to disability-related bias and revise their algorithms as needed with this in mind. Moving to the next category of access to benefits and how AI is impacting people with disabilities in that space, we heard and understood that many disabled people rely on timely and accurate administration of public benefits to live independent and community integrated lives. But we also learned that many times disabled people are unfairly denied access to benefits as a result of algorithmic systems being utilized. There were three key areas where many of the public comments and testimonies at our hearings kind of categorized in. And the first use that we heard where there is a lot of AI use in benefits determination is in customer service chatbots, where human engagements are limited or fully replaced. And so those chatbots may not be accessible to people who have disabilities. The second area that we learned where AI is being utilized in the benefits determination space is fraud detection and benefits determination systems. Again, both the chatbots and fraud detection are beneficial opportunities, but they come with risks and can be discriminatory and inaccessible. And lastly, the third category, we heard about AI being incorporated into the algorithmic system that's being utilized to assess eligibility and the size of the benefit award. So we heard that these were referred to as benefit determination algorithms. So where there was a limited or no human oversight of an AI determining those benefits was an area of concern and risk that was raised. So for people with disabilities, some of the recommendations at this time would be that those that may experience a denial of public benefits or a reduction in benefit award should be sure to keep a record to the best of their ability and to track those determinations and decisions. And you may want to consider contacting an advocate to help determine whether AI or an algorithmic system improperly affected the outcome of the case. And so keeping a record and asking questions both on your own behalf or with the utilization of an advocate are recommendations if you have experienced those. For those public sectors that are managing benefit determinations and services, a couple recommendations here in that space. So encouraging state and local agencies that administer public benefits to be sure that they're using all available federal guidance to mitigate the risk presented by the use of AI. And so we hope that you will utilize the technical assistance and guidance that are out there at the federal level to ensure that you are mitigating those risks. And secondly, it's important to conduct and publish annual inventories of how AI is being utilized, including those related to benefits determination. So that transparency of those inventories is recommended, as well as it's recommended to ensure that the uses of AI remain human-centered and have that necessary human oversight. So while AI might increase efficiency and address backlog, losing that human-centeredness and oversight could create barriers and risks to people with disabilities. Again, ensuring that beneficiaries are notified whenever AI was used in making a benefits determination so that the person who has applied for the benefits has an understanding that their determination was made with the use of AI, not just a human determination. And then providing those beneficiaries with ongoing information of what are their rights and the process of redress and appeal if they have concerns about decisions or outcomes based on their benefits determinations. I'm going to talk a little bit about ICT at this time. We heard a substantial amount around how AI is impacting information communication technology, both in the positive but also in the risk. And so just to go over a few things, ICT is really encompassing any and all technology used to facilitate communication and information exchanges. So this can be very broad reaching. And this can include hardware such as your smartphones, your tablets, laptop computers, and software, which could be video conferencing or say a platform like Zoom, which we are on this session today, and word processing applications. And telecommunication networks are other ways in which ICT can be present. So some of the recommendations for ICT from this series and what we've heard is that to protect your privacy, people with disabilities should consider opting into the minimum amount available of information and location sharing in order to achieve the needed access or desired services. So making sure that you're aware of what are your options as far as privacy and location sharing within the AI product or tool that you're utilizing. And you may want to select limited or even opt completely out of those privacy and location sharing options within the tools. And this can vary based on the different tools and platforms that you're utilizing, but exploring what is your privacy and what information is being shared and your location being shared. You should seek out and understand how those are intersecting with the tool that you are utilizing when you are using it to for ICT. And by doing this, this may also allow for you to have more control over your privacy while also allowing you to achieve the maximum benefit of the technology. So understanding if your captioning tool is keeping a record, if it's available to third-party members and so forth. And that's just one example. This again can vary based on the tool and the platform being utilized, but understanding your own privacy and your location sharing options of the tool that you're utilizing. So for the private sector, there are three key areas where I want to talk about some ICT recommendations. So the first starts with privacy, ensuring that assistive technology developers really are ensuring that the tool has privacy protection, including in making sure that they're adhering to the principles of minimizing the amount of data and limitations of the purpose of the tool, of interacting with that information to protect sensitive and or disability related data. So really making sure that there is a commitment to privacy and accessibility and making sure that to reduce the risk for people with disabilities and providing them increased privacy. The second area is around plain language. making sure that privacy policies themselves are written in plain language, or that there is at least a plain language version available so that people with certain disabilities are able to understand what are their data privacy options and what may be shared about them with third party or even the tool and the developing software entity. And lastly, ensuring that the AI tool is compatible with accessibility, making sure that those tools are accessible and compatible with other assistive technologies to ensure that people with disabilities have equal access to that benefit of the technology. So one example would be ensuring that the tool is screen reader capable. And that's just one example. So for our public entities and federal partners and state and local governments and so forth, some ICT recommendations to remember is that there are oftentimes accessibility coordinators in this space, and making sure that those coordinators are also involved in the procurement and implementation of AI technologies so that, that they both have an understanding and an opportunity to input from the perspective of accessibility during all stages of the adoption of AI tool use. And that public entities should ensure that accessibility coordinators are also receiving training on the use of the AI tool so that they, again, are incorporated into those processes. Moving into healthcare and how AI is impacting people with disabilities in healthcare. We learned a lot about how healthcare and hospital systems are utilizing algorithmic and AI tools to aid in various types of decision making, as well as with addressing backlogs and current needs of administrative tasks. AI is used also in at-home clinical care as well, like for example, in monitoring a glucose level and administering insulin. So that's one example of how there are some AI tools and uses in the healthcare space. So during the hearing process, we heard a lot about how AI tools can be used in the context that impact medical treatments and how treatment is provided. And this can be particularly concerning for people with disabilities. We heard about the term triage algorithms, which are used to determine at what level of care might be provided to a particular individual in an emergency room setting. So again, limiting or removing that human engagement of the triage process to ensure equitable and timely care. Melanie Fontanez Rayner from the Health and Human Services Civil Rights Division shared a lot of insights, but one thing that was profound and also an opportunity was Melanie shared with us during her testimony in the hearing that if providers use AI tools responsibly, they may have the potential to improve patient outcomes, reduce health disparities, and increase access to care. And again, I think the key here is responsible use of AI can be beneficial, and we want to make sure that we're mitigating risk and improper use and discriminatory practices of use of AI. But when they're used responsibly, there's a lot of opportunity to improve outcomes for the disability community in healthcare. So healthcare recommendations for people with disabilities related to AI, there are three key recommendations that we have today. And the first is use the available support to you. So that may be a patient advocate or another service that may be available to you during within a hospital setting and or interacting with your healthcare providers to see how AI and what other supports you may have to ensure equitable treatment as a person with disabilities. Secondly, we encourage the review of your health record, making sure that people with disabilities are reviewing their electronic health records after a doctor's visit or a hospital stay to make sure that the information that there is accurate, and perhaps engaging a trusted family member or advocate or caregiver to help you review that and keep track of your own healthcare records to see and making a notation if there is an instance where AI has been noted or utilized. And there's an encouragement to use HIPAA covered apps. So there are healthcare apps that are designed to protect your privacy. So patients can review and should review their electronic health records on HIPAA covered apps or utilize services directly from your medical provider. And so that's something that we strongly encourage, because the use of a third-party app or service may result in an unintended exposure of your health data. So those are the 3 recommendations for people with disabilities related to healthcare. For the private sector recommendations, hospital systems should conduct pre-deployment audits that focus on the impact of AI and algorithmic tools with people with disabilities. So making sure that there's some baseline information conducted before the deployment of AI and ongoing audits to see how the AI in algorithms are impacting patients with disabilities. Further, before using at-home monitoring techniques as part of a care plan, making sure that the patient, and in any instance, is fully informed of their privacy implications of these technologies. So moving into transportation, we heard how in the transportation space, AI and algorithmic tools, including facial recognition, technologies are being incorporated into many of our aspects of transportation, often as a part of security and screening measures. So in the airports, terminals, and public transportation, there's an increased use of these tools. And some of these tools heavily rely on biometrics, which are our unique physical characteristics, like a fingerprint or a facial feature used for that automated recognition of the individual to make an identification. And so for travelers with disabilities, we recommend that you may want to consider requesting alternative security screening measures. So for example, at the airport at TSA, the TSA does offer travelers this option if requested, that's available to you, particularly if you are not able to or do not wish to undergo facial recognition screening. So making sure that you understand your rights to alternative security screening measures, and make sure that you understand what those might be and plan the time that may be needed for those alternatives as well. So for our private and public sector partners, some of the recommendations are that developers and deployers of AI tools in the transportation space should be evaluating these technologies, especially those that rely on facial recognitions or other biometric inputs for people with disabilities, particularly when their disability may impact their biometrics or their facial or bodily features. Equitable processes should be established to make sure individuals who are unable to provide those inputs of their biometrics, that they have an alternative process that is also equitable. Transit agencies should carefully assess how AI technologies, they should really be assessing them prior to deployment for potential impacts on riders with disabilities. And post-deployment audits are encouraged so that they can include how people with disabilities may have been impacted by the use, and that can be tracked and monitored as well. So in the last category that I'm going to speak on today at this time is the legal system. And so AI and algorithmic tools are currently being used to help make determinations in the context of the criminal legal system. So we heard both in the hearings and in public comments about how the use of AI is being utilized in the criminal justice system and legal systems. And so one thing that I wanted to highlight was when we heard testimony from the legal director of the Bazelon Center for Mental Health Law, Megan Schuler, had shared with us more on pretrial sentencing tools. And so in this, she referred to how AI tools were being utilized in the system that were recommending an outcome or were exploring recidivism rates of that person. And so in a lot of ways that these could in turn end up determining an outcome before the trial has occurred. And this was particularly concerning that it could amplify some existing systematic disability biases when these tools are utilized. And there were several public comments that also echoed and raised those concerns on pretrial assessments that are utilizing AI generative algorithms, either replacing in whole or in part that human oversight and utilization of those assessments. So, our recommendation for people with disabilities related to the legal system is that individuals with disabilities who have an interaction with the criminal legal system may want to consider disclosing their disability to their advocates, which may help the advocate raise any related concerns regarding the use of AI algorithms and tools. So that, again, that's a personal choice, but that's something that may help in that space. And understanding when and where the AI tools have been used is important. So for the private and public sector recommendations in this space, for attorneys representing a client who may have disabilities, making sure that they've been educating themselves and understand what type of risk assessment tools are being utilized by the prosecutors, courts, probation, parole offices, or other justice entities, making sure that you are able to best represent your client by understanding how AI tools have been utilized in the process. And then secondly, ensuring that there is a meaningful opportunity to raise concerns about and dispute any inaccurate or biased information that has been informed by the algorithms. And lastly, state and local police departments are recommended to implement AI risk mitigation measures modeled after those from the Office of Management and Budget's Memorandum M-24-10, which I've linked in the slide for everyone's review and utilization. So as I conclude, I just want to talk a little bit about some general recommendations for all areas of use of AI for all of us to keep in mind as we move forward together. And the number one thing is that people with disabilities need to be included in the development and implementation of AI. And this really means all stages of AI, including increased employment in technology positions of the creation of these tools, procurement processes, development, the implementation and maintenance of AI going forward. Secondly, it's important that we collectively work towards minimizing bias in AI. AI data systems must be trained with diverse data sets that include that wonderful, diverse representation of people with disabilities to minimize bias. It's important that the disclosure of the use of AI is transparent and clear to end users. So that people with disabilities know when and how AI is being used so that they can assess whether they may be unintentionally impacted through the use of that AI and whether or not they wish to continue knowing that the AI is present or being utilized. And so being able to have that autonomy of choice starts with the disclosure of use. And then ensuring that deployers and developers of AI technologies are continuously monitoring and assessing their products in regards to how their product impacts people with disabilities. And so at this time, I'm going to take a pause in my presentation, and we're going to switch gears to switch over to our partners at CDT and AAPD. And we are excited to have them provide us with a presentation. Before I give them a chance to introduce themselves, I just want to clarify that their presentation is not necessarily an endorsement or reflective of the viewpoints of the Access Board. This is CDT and ADP's independent presentation, but we welcome their presentation at this time. And so Ariana and Henry, it's been a pleasure working with you both on this project, and just want to turn it over to you all to introduce yourselves and begin your own presentation at this time.
Thanks, Amy. I'm Henry Claypool. I'm a technology policy consultant at the American Association of People with Disabilities. Quick visual description: I'm a white male with brown and graying hair, with glasses and a green pullover sweater. I'll turn it over later to Ariana to let her do an introduction, but I wanted to quickly recap some of the project. Give you some sense of the work that we have underway and what there's more to come. Can you go to the next slide, please? And the next. Okay, so in our first year, it was a great opportunity working with the Access Board to really expand our reach, to gather more information, to have a great platform of working with a federal agency to both get information and put information out into the world so that people can engage in this topic. We were, of course, honored to do this, and we've really happy that we had at least almost a year now under our belt of engaging with folks and producing some material. But what we have to look forward to, and if we can go to the next slide, is we will be producing a report that really goes into some detail about specific areas that have already been touched on by the Access Board. But we'll talk a little bit more in the report about recommendations for industry or private actors. We'll look more into making recommendations for federal agencies, and they will track very closely to what you've heard today in the presentation by Amy. So that report is compiled and being processed, and it will be published at a date soon. We will be producing this primarily through CDT's channels, and we will be sharing it with the Access Board as soon as it's done. And again, hope that in our partnership with the Access Board that we can expand its reach further. And next slide, please, and I can turn it over to my colleague, Ariana.
Sure. Thanks, Henry, and thank you, Amy, for kicking us off so well today. Hi, everyone. My name is Ariana Abulafia. As a quick visual description, I am a youngish, now I'm in my 30s. I have long, curly brown hair. I'm wearing a blue and white striped shirt, and I have gray rimmed glasses on. My background is blurred. I lead the Disability Rights and Technology Policy Project, the Center for Democracy and Technology. We've been referring to as CDT throughout this. And it's really been wonderful to have, close out, as Henry mentioned, our first calendar year in our partnership with the U.S. Access Board. And so what we wanted to talk about pretty briefly today are some federal agency recommendations that CDT and AAPD came up with that's partially, informed by the insights that we heard throughout the community engagement that we conducted alongside the Access Board. And so we decided to, for those of y'all who have been present throughout the many webinars or who were present during the first webinar, Henry and I, in our representative capacity with CDT and AAPD, talked a little bit about some background on disability and AI, and we focused on employment and benefits in healthcare and what disability and AI can look like in those spaces. And we wanted to kind of come full circle in this one and talk about some federal agency recommendations in those three categories as well. So I'm going to talk a little bit about some employment related recommendations for agencies. And again, all of these recommendations are meant kind of to move towards more inclusive AI practices for people with disabilities. So we recommended that the EEOC uplifts and updates its previous guidance. The EEOC had previously released guidance on AI tools and disability that reminds employers that AI integrated employment tools like resume screeners or computer-based tests may potentially violate the rights of disabled workers under the ADA. Companies are required to provide reasonable accommodations for people with disabilities under the ADA. This can include during their interactions with AI and algorithmic tools, and those are like some of the tools that Amy mentioned earlier, like automated employment decision systems. And as technologies continue to evolve, agencies must keep this guidance up to date as well. And we can go to the next one. We also recommended that agencies issue guidance for employers that includes the following. That employers who wish to use automated employment decision-making tools or automated employment decision systems must first demonstrate that the tool is a valid method of illustrating that an employee is able to complete essential job functions. This is also referred to as job relatedness. That employees must disclose to workers that these tools are being used. That gives them an opportunity to request reasonable accommodations if they may need them throughout the hiring process. And that employees with disabilities have the right to opt out of automated employment decision tools if they're inaccessible or if they're unable to be made accessible via accommodations. And if that's the case, then alternative procedures for hiring that are accessible must be made available. You can go to the next. And so I'll turn it back to Henry to give some recommendations on our next area of interest.
Thanks, Ariana. Again, these recommendations will relate more to agencies that administer benefits programs. Just to remind us all, there are several federal agencies that administer these programs. The Social Security Administration certainly does in the form of the Supplemental Security Income Program and the Social Security Disability Income Program. And at the Department of Health and Human Services, there are a couple of agencies that administer benefit programs, namely the Administration on Children and Families and the Centers for Medicare and Medicaid. And programs like TANF are at the Administration for Families and Children, and Medicare and Medicaid, of course, at the centers there, CMS. The VA is another federal agency that administers programs that are largely federal, delivered through its own healthcare delivery system. And so there are, these are really important safety net programs in almost every case. And often, particularly the programs that are operated out of Health and Human Services can be or are administered at the state level. So they're either in partnership or almost wholly administered by state government. And so there were federal, I guess going to the next slide, there are resources that have been produced. The executive order kicked off an awful lot of work, and the federal agencies have been quite busy working at the intersection of AI and benefits administration. And while those requirements are in place for federal agencies, we'd really like to encourage the state and local governments that have a role in administering these programs to look at that in that detail and those recommendations and that guidance and put it to work in their role administering these programs. Why is that important? These are programs like the Medicaid program, which touch millions of disabled people across the country and provide critical life-sustaining support. And so we really need to support states and federal agencies to continue to take this seriously and think about the implications for administering benefits programs. And we've got a few recommendations that, again, our report will provide these in writing and go into greater detail in other areas. So first, if you're administering these programs, we really recommend intensive stakeholder engagement with disabled people. And that can come in the form of listening sessions or gathering information, educational webinars, and more. There is a great opportunity here to do, and probably necessary, to do a pre-deployment audit of the tool, making sure that it really works before you put it out and make it live and allow these benefits to be administered through the process. In the deployment of the algorithmic systems, you really need to think about doing this in a phased approach instead of just opening it up and applying it to the whole system, really targeting that enrollment and thinking about how you're going to roll out this so you can test and verify that the impact assessment is working for the populations that it's designed for. So those are some steps there that we think are critical to take, and that hopefully both the federal agencies are already doing these, but hopefully the state agencies that administer these programs will be looking to resources that are produced by the federal agency. Another quick one before we round this out, integrating responsible AI practices in your procurement process. Remember, state agencies are often not extraordinarily well staffed, and they will hire vendors or vendor products to do the work that they need to do. And that process of procurement really is where the rubber meets the road. That's where you're going to do the due diligence to make sure that the tool is actually working the way it should, and that when the state or local entity deploys it, that it won't have the adverse impacts that have been described today, and certainly hope to avoid discrimination. And throughout all this process, we really hope that we retain a strong federal role in oversight of the benefits administration of these critical programs. I think the next slide goes back over to Ariana.
Sure. Thanks, Henry. This is Ariana again. So I'm going to talk a little bit now about some healthcare related recommendations. And so Amy had mentioned, some of the potential concerns that people with disabilities may face I just want to make sure our ASL is working. One moment. No, our ASL is not working. I'm going to pause until our ASL is back on. Someone can give me a thumbs up when the ASL is ready. Yes.
ASL is on.
Okay, great. So I'm going to give some healthcare related recommendations for mostly HHS. Although, as with benefits determinations, there are other agencies, including the VA, that interact with healthcare services and that also should be cognizant of algorithmic and AI integrated healthcare tools and the impact that they can have on people with disabilities. And so those other agencies can also consider these sorts of recommendations and think about them as a course of potential best practices. So we recommend that HHS, Department of Health and Human Services, consider recommending that federally funded hospital systems not implement AI health monitoring programs with the express goal of replacing nurses or other healthcare professionals. This is in large part because these sorts of AI health tools are not necessarily perfect, and they could miss things that a human healthcare provider could catch. We also recommend that the department consider requiring federally funded hospitals that already use algorithmic systems to have those algorithms audited for racial, gender, and disability bias. And throughout the course of this conversation, you've sort of heard this term, so I'll just kind of explain it a little bit more. So that's what we refer to as a post-deployment audit, meaning that it's already been deployed, it's already being used, but we still think it's important to audit it for potential biases. A pre-deployment audit, on the other hand, is exactly what it sounds like. That's when a tool is audited for those sorts of biases before they're put in. But even a post-deployment audit, right, if it's found to have some sort of bias, can have an impact in potentially changing the system of choice or something like that. So we can go over to the next slide.
Thank you, Henry and Ariana, for your work, your dedication, and for sharing your presentation with all of us today. I'm going to just talk briefly about what to expect in the next steps in our collaborative partnership. We signed the MOU in partnership together with CDT and AAPD to go through May of 2027. So this is not the end of our work or our collaboration. This work is going to continue. And there may be a need for us to adjust some of our goals as this technology is ever evolving. Our response and our goal and our focuses will also need to continue to change and focus and evolve as well. And then we want to make sure that we are collectively providing more and ongoing education and training on AI through this partnership, as well as providing more opportunities for the public, our federal partners, developers, deployers, and so forth to provide feedback and engagements with us on how AI is continuing to impact the disability community, federal agency use, and also from the perspective of AI practitioners. So again, today's findings, we really framed it as initial findings because this work is going to be ongoing. And we look forward to doing that collectively with our partners, but also alongside the disability community and the AI practitioner community as well. So with this concludes the presentation portion of today's event. And so at this time, I'm going to hand the floor back over to you, Madam Chair, for the next parts. Thank you so much.
Thank you, Amy, and thank you to Henry and Ariana for your presentations and the impressive work to ensure equitable access to people with disabilities around AI. I also want to take a moment to acknowledge Allison Levy, who is the director of the Access Board's Office of Information and Technical Services, for her leadership on this work. She wasn't able to join us today, but I'm very excited to see this work continue and thank our partners at AAP and CDT for this outstanding partnership. It is now my pleasure to turn it over to Sachin Pravarthan for a few remarks as we prepare to close this session. So Sachin, over to you.
Thank you, Madam Chair. Good afternoon, everyone. It's a pleasure to be with all of you today. I want to start off my remarks by thanking the Biden administration for including the voice of the disability community in this important work. The work for artificial intelligence is new within the disability community, and I'm appreciative that the administration made sure the disability community was included in the executive order. I also want to thank our partners, both CDT and AAPD, especially Henry and Ariana, for your diligence and your hard work in this space. Your expertise definitely complemented the work that we were trying to accomplish from this executive order. So thank you, Henry and Ariana, and the leadership within CDT and AAPD for making this a possibility. Your collaboration and your partnership is very much appreciated. I do want to recognize the Access Board team, Allison Levy, who is not here, who led the work for AI within the Access Board, and others on our team who has done a lot of work in the background to make sure the hearings took place, and also working along with our partners. So as this work is still in the early stages, there's still a lot more to come when it comes to artificial intelligence and the work the Access Board is going to be engaged in. As Amy mentioned, we may have to reset our goals depending upon where the technology takes us, but we are committed to continue to work in this space. Before I wrap up, I do want to recognize our chair, Katie Kale, who has been a tremendous leader for the Access Board. She's been a federal member for the last few years on the Access Board, and the first time I met Katie Kale in person, I believe we were in Philadelphia during one of our out-of-town meetings, and Katie has been a huge partner for the Access Board, a huge champion for the work that we are doing. And with Katie's leadership at GSA, our relationship with GSA has strengthened, and we appreciate our great partners at GSA. Katie, I hope you know you have a friend at the Access Board, and you can always count on us, and we really appreciate the work you have done at GSA, but also we want to recognize you for the hard work you have done in spite of all that you have to undergo and all that you have on your plate by being the Deputy Administrator of GSA. You have really led the Access Board over the last couple of years as a board member, and then as a vice chair, and now as a chair. So you will be missed, and I hope you can always count on the Access Board whenever accessibility is concerned. We do have a plaque for you. I wish I could have given this to you in person, but it will be mailed to you, and I hope you will appreciate what we have done for you. So thank you, Katie, for your leadership, and that I'll turn it back to you.
Wonderful. Thank you, Sachin, for the very kind words. Before we wrap up, I just want to say thank you and just what a true honor it has been to work with you, your amazing Access Board staff, and to get to know the wonderful board members that I've worked with over the last 4 years. As you alluded to, as a member of the Biden-Harris administration, this is going to be my last session with the U.S. Access Board, and I am so proud of the work that we've been able to accomplish together. And while I may not be here to witness the important work that you're going to continue to do, not only in AI, but in so many other important areas, please know that I'm going to continue to cheer you on, but it will just be as a member of the public. But I know that you're all going to continue to advance accessibility and inclusion for people with disabilities. And I am truly looking forward to listening in on the public meetings in the future. Speaking of the continuing work, even though today was a culmination of the Access Board's AI series, this is not the conclusion of the work that they're going to be doing on AI, but a way to continue our efforts to create access for all, especially regarding artificial intelligence and disability. I want to reiterate our thanks to all the speakers and the attendees. We appreciate that you made the time to come here today. We have these in the chat, but you can continue to engage with us on AI by email at ai@access-board.gov. Today's presentation and all of the AI series information and resources are available on the website access-board.gov/AI. Please subscribe to Access Board News to receive updates regarding the hearings and other news. And that's at access-board.gov/contact. You can also contact AAPD and CDT by email. The American Association of People with Disabilities can be reached at communications@aapd.com. The Center for Democracy and Technology can be reached at hello@cdt.org, and the Access Board can be reached at ai@access-board.gov. For technical assistance, contact ta@access-board.gov, or you can call at 202-272-0080, extension 3. With that, this concludes the Access Board session on our initial findings on artificial intelligence. Thank you for joining us.